Hi everybody, welcome to another video. We're back again. Thanks for tuning in. My name is Dr. Elise Tercy. If you do not know me, this channel is really dedicated to all things holistic health and wellness. We talk about everything from aches, pains, body pain, painful periods, hormone imbalance, autoimmune conditions, all types of things. So if you're here and you're new, thanks for tuning in. For all of you guys that know me, welcome back. And today we're talking about a really kind of under talked about topic, but something I definitely wanted to create some awareness for and keep the conversation going around this topic because it's something I see in clinical practice. The topic is post-viral syndrome, or I could rephrase that and say post-C19 sequelae. So what we're talking about today is what are the later things that happen, or what are some things that happen after I might have had C19? Like, what can I expect? I know there's a lot of talk about what happens to me when I have the infection. We talk about people losing their sense of smell, their sense of taste, so their olfaction, their gustatory senses. Basically, we can lose that. We also know, obviously, there's a lot of respiratory components connected to the nature of this virus. Something that's not really discussed though is if I do happen to get this, what happens longer term? What types of things might I be wanting to know about longer term? And this is coming out more and more in the literature. There are more and more studies and case studies and all different things coming out. As time passes, we obviously learn more about what are the kind of longer term effects to C19. Something I want to share with you guys as well is that this concept is not new. You might be watching this thinking, oh, this only happened ever since C19. That is not true. All of this stuff that we talk about, it's called post-viral syndrome. It can happen after any viral infection. It actually can even happen after bacterial infections. So for example, things like Lyme disease. Lyme is a tick-borne disease. It's of bacterial origin. The species that we know of that causes Lyme is called Borrelia burgdorferi. And there's other things too that we pick up, things like Babesia microti, Bartonella hensley, and we basically get ingested with different types of spirochete bugs, which are bacteria. What ends up happening long term is that we end up developing these other symptoms that might not show up right now when we're not feeling well, but could also happen even months or years down the road. So this concept that we're talking about is post-viral syndrome. It also can be post-bacterial syndrome. It's more associated with viruses and parasites or more stealth infections, but it's a real thing that has happened for many types of things. So it's not a new concept, if you will, but I do want to talk about it in kind of the sense of C19 because a lot of my patients that I'm working with are coming in and they're starting to say, ever since I had this, something is not right. I'm finding that I'm breaking out in rashes. I'm finding that my anxiety is not going away. It heightened when I wasn't feeling great, and now I'm having this residual effect. Really what we're talking about is longer term or residual effects of C19. Now we're still in it. We're obviously still in it. So these are just a couple things that, like I said, I want to share with you guys I'm seeing in practice. Okay, so I'll have some notes. That way we can talk a little bit about, what it is, just to remind us. One of the things I'm seeing that's a pretty big deal is a lot of people find that when they have C19, they do feel anxious. They kind of know that. They're like, I do feel some increased anxiety. And that usually follows like a little bit of a bell curve where it's heightened and then it gets a little bit better. Sometimes though, for some of the patients that I'm working with, they're finding that the anxiety does not get better. It gets worse and it stays worse for them. Little caveat, little side note is that all of the things I'm talking about can be supported. And so you might be thinking, well, if it's a virus, what do I do? I thought that there wasn't actually any cure for a virus. That is somewhat true and somewhat not true. But there are natural things. If you're someone that's looking for support or natural remedies, just know that they're out there. Okay, just know that they're out there. So I'm not going to talk today about that. That would be working with someone like myself or someone, another provider that can support you through that process. But there are things that I'm using in practice with my patients to support them and their immune system, and really get them feeling a little bit better when they're saying, I'm not letting go of the symptom for whatever reason. But anxiety is absolutely one of them. Massive increases. Now, what I'm finding to be true is that if someone's already like baseline anxious, they find that the virus makes them more anxious, and it kind of exacerbates what was already there. I'm not really finding that people are saying I'm developing anxiety. I'm really just finding that the people that are already struggling with anxiety are saying it got worse. Okay, so I'm not really finding like a new occurrence of it. Although, to be very honest, a lot of people are naturally just dealing with anxiety. So it's something that I'm seeing that is ramped up, but it is a little bit more prevalent because that is something that we deal with. So increased anxiety, also impairment with memory. So I am finding that there's a little bit of a memory and cognitive thing that's happening where people are saying, I'm forgetting. I'm really, really forgetful. I can't remember the word that I'm trying to remember. I can't remember how to get there direction-wise. And I always share this with my patients because this is an important part of just mental health. We don't really use short-term memory at all. Like, we don't use it in our life. We put everything in our GPS. We have everything in the phone. Everyone's phone numbers are stored. You know, when I grew up, I remember, for example, maybe going to the movies and I'd have to remember phone numbers so that I can call my mom for a ride home. And we'd have to do more memory kind of recognition or recall. We'd have to challenge ourselves to actually recall things. That's really not the case anymore. So it is natural to some degree that we're not challenging ourselves with short-term memory, which can cause us to feel like, what the heck? I can't seem to remember something so simple. I can't remember her name, or I can't remember how to get there. I can't remember the word that I'm using, or I'm starting to put things in weird places. I had someone share with me that they put their remote in their fridge, which sounds a little scary, and it certainly can be. But there are connections, and this is something that you can find on websites that are doing the research that really are saying that there is cognition and memory impairment. And so if you're like finding that symptoms are there, I just want you to know it's very normal, and that we need to kind of really create conversations around what happens after I've been exposed. It's like we hear all about what to do to prepare, right? We hear all about what to do if we think we have it. We hear all about, all this crazy stuff happening, but no one's really talking about what happens after, the aftermath. Okay, that is another thing I'm seeing. Something I am also seeing in practice is that people's blood work findings are looking, I wouldn't say worse, but they're infected with C19. And I'm finding that more and more people are starting to develop a positive autoimmune condition. They're having in their lab work positive ANA, which stands for anti-nuclear antibody. It's a pre-screen test that tells us, are you actually having problems or making autoimmune cells to any tissue in your body? Okay, so a positive ANA could be for many different types of categories of infections and diseases and autoimmune conditions. It really is just saying, does this person have some type of autoimmune disease happening? Yes or no. It doesn't tell us which one. It does in some degree. That would be a next step test, which looks at titer load and also the pattern, whether it's speckled, cytoplasmic. These are things that we can look at under the microscope from a lab perspective. But I'm finding that there is an increase of positive autoimmune titers in people's blood work after they have had C19. And for them, I don't know if there's correlation to this. Maybe it's nothing to do with it, but what I am finding is that people that never had autoimmune titers in their life are starting to say, my immune system is on. And it's very normal for obviously that to happen when you're infected to some degree, but we shouldn't be creating autoimmune conditions from that. There's this kind of fine dance that has to happen with the immune system. And so with that being said, I am finding that people are saying, my immune system is definitely on. I have a positive ANA. I never had that before. Another thing that also is happening for people that I want to kind of talk about is some heart stuff. Now, there again, this is not new. Stealth infections, mold, metals, mycotoxins, if you will, parasites. There are times that these things can create cardiomyopathies. And so that is a real thing in life where people are bombarded and exposed to maybe toxic things in their environment, environmental toxins that end up leaching into our tissues and stay in our bloodstream and can create problems for us. If that happens though, it can create damage to the heart. So cardiomyopathy are basically, it's basically just a term that the heart is having some inflammation. You can think of it that way, inflammatory condition of the heart. And it's more ventricular dysfunction that they're finding, especially with some of the research that's coming out. There is connection between heart stuff and also C19, which when we talk about the heart, that's regulating circulation. That's also regulating sometimes our blood pressure. The kidney does that as well, but there is a lot of connection here. So you guys are probably starting to get the point that you might say, yeah, I had C19 and survived it. I was maybe not feeling great during it. I got better, but I really didn't get fully better. I got better to some degree. And then all of a sudden I started to notice these strange things or these new things for my health that I've never had before. And that could be very normal. Like I said, post-viral syndrome. This is not new, but it might be affecting you. So if you do think that you're struggling with something like this, of course, connect with someone. Now, there's a lot of natural things that we do in practice, myself included. So obviously manual work, manual manipulations are really supportive for the nervous system. And also herbal remedies. There's lots of natural herbs that you can use to support the immune system. Enzymes, absolutely. I have an entire line. I call them the red line bottles, which they all come in red labels. They're the heavy hitters. They're mega dose enzymes that are made for lymphatic support. They're made for the immune system. You can't get them, unfortunately, from the store. They're not digestive enzymes, which I know a lot of you guys are familiar with, the digestive caliper, but these are lymphatic immune enzymes. So megadose citrus bioflavonoids, megadose polyphenols, pancreatin, protease, megadose enzymes for the immune system to help support any type of, think of the self-infections as broad spectrum, parasite, fungus, bacteria, yeast, mold, and virus. Those are like the umbrella of some of these kind of weird critters that can come in and really create host dysfunction or immune system dysregulation. But just know that there's options out there if you're like, I'm struggling and I need help, okay? I hope that you guys found this video helpful. It is a shorter one today. I'm about to jump on our Epstein-Barr virus workshop that's starting here in about an hour. So I'm so excited. I hope that some of you guys will be attending that. I am probably going to do another one. Of course, I'll update you in terms of when that date might be, but I hope that you found this helpful. As always, give this video a thumbs up if you found value to it. And be sure to subscribe so that you stay up to date with all things health and wellness related. And I will see you guys in the next one.